illustrations you have shown. And this is very important thing that obesity, what nowadays very burning topic, and people needs to know about the obesity and all the consequences. What she has mentioned about in detail about the obesity, and also she has mentioned about the sarcopenic obesity. Because frailty is nowadays a very important term that people maybe looks wise he or she is fit but obese, but the sarcopenia is there. So that should be taken care of properly. And also she has mentioned different genes that leptin, ghrelin, and all the white adipose tissues, brown adipose tissues. So being an academician, so I don't go in detail, but these things are very important, that there are connections between the obesity and the cardiovascular are so important. Because I think there are so many students are there. We all read about the metabolic pathways, sequeling, de novo synthesis. So this is all about related with the food and how to utilize your food. We try to utilize the food and to energy, and basically we try to utilize the food to the Krebs cycle and then go for the cytochrome pathway for the electron transport system. Not that food for going to the de novo synthesis or this metabolic pathway or the sequel and all those things. So how to utilizations of the food, how to utilization of the nutrients, those the biochemical pathways are so important. And also she has mentioned about the pediatric surgery, because I have worked a lot of pediatricians and pediatric surgeons. There are a lot of operations after we can see the remission diabetes also happening. Because the pediatric, there are do-and-why operations or vagotomy or mini gastric bypass surgery. There is a different shades of different, the nutrients absorption pathways are important. So in that cases, and also she has mentioned about the heart failure patients. So what we have seen for the reduced ejection fraction, just less than 40% of the patients, there are maybe they are taking the ARNI. ARNI is a new drug of the medication, sacubitril valve, certain other medications are there. So if the patient, there are a lot of fluid restrictions, and so if the patients are too obese, so it will be very difficult for him or her so maintain the fluid restrictions and following the proper diet. Because the heart failure patients, the reduced heart failure patients are very stringent to follow, because during the summer weather, and 1 liter of water and 800 ml of water with the other diuretics is so difficult. So in that cases, so we have to take care in the proper, what she has mentioned about the diet prescription. It should be calorie wise, individualized, and the counseling part. What ma'am has told about the counseling. The counseling part is very important, because patients sometimes doesn't know all these medical jargons. So according to their language, how to counsel. So she is Bengali, Vijaya is my one of my colleagues is Bengali. So she has mentioned the thripti gene. So thripti gene in Bengali we can say the kipte gene, but both can use. So that way ancient chant that was there. So it's overall is a very eloquent, very lucid, and we know Dr. Varma is a very lovely orator. So thank you so much for being here. Thank you.